Tyler Mason here with another 3-Minute Thursday. Today we're going to talk about the most important things to consider when looking at a Medicare Advantage plan. And I'll tell you this, it's not necessarily your doctor. It's not necessarily your prescription drug coverage. It's definitely not going to be dental and vision and hearing benefits unless everything else is taken care of first. See, here's the thing that I find when I work with my clients and we're looking at Medicare Advantage plans. Generally, the first thing that they want to make sure is they can keep their doctors. And I know that that's important. I know that when you've got a doctor that you know and trust, you don't want to have to find a new one. However, biggest thing that should be considered, what sort of care are you going to need? If you've got a chronic condition, if you've got a lot of medical frailty that requires a team of doctors, that requires a lot of medical evaluation, then what you need to be looking at is which plans are going to best meet those needs. And sometimes that may mean leaving the doctor that you've known for a while behind to get the best possible care that you need for those other more pressing medical concerns. Okay. Now, if all of those can be met, if we can get your doctors in network, we can get all of the medications covered at the lowest possible cost, and we can make sure that we're meeting all of those medical needs, then that's a great plan to choose. But if you've got to pick between losing a doctor or maybe having a medication that's a little bit more expensive with one provider versus another, but it's going to better meet those needs either by giving you access to a broader network, by giving you lower co-pays for your doctor's visits, specialist visits, your tests, any sort of observation, then those are the things that really need to be considered with those Medicare Advantage plans. Then after that, then we can start looking at the other things like the dental and the vision and the hearing. Now, if you're in relatively good health and you know for a fact you've got maybe an outpatient surgery, a knee replacement, for example, or cataract surgery, or you know that you've got major dental work that's got to be done, well, then we've got a lot more options we can look at. But the first thing that we need to consider is your medical need. How are we going to make sure that all of those needs are best met? Here's the best part. Once you pick a plan, you're not locked into it forever. If you've got a good agent, they're going to check in with you every year, and they're going to make sure that we have the best possible coverage from year to year. If you got questions, reach out. As always, thanks for checking, and I will see you in next week's 3-Minute Thursday.